Hi gang, I'm Dr. James Schaller in Florida. I specialize in treating treatment failures. You're not the failure. The treatment or the treaters are. That doesn't mean they don't like you. That doesn't mean they're not smart. Doesn't mean they're not trying. It's just they may not know, let's say, all. So the thing is, be greedy for cure. Be greedy for complete removal of your depression. Now, there are some articles that make comments like, well, if you're 70% improved of your depression, you would have thanked your lucky stars and just be happy. What? Oh my gosh. There's so many insulting, devaluing things said about patients that have some psychiatric challenges, which are probably the #1 illnesses in the world, depending on what you read. So it's kind of like telling all blacks, all Orientals, or all whites, all Hispanics, you really should not be respected. It's insane. We're not respected as other problems. So if you have cancer in your brain, you deserve better care. And they will cut out the brain 100% that's going to kill you, and that is malignant cancer. In my depression treatment, if you have any residual depression, we do treat it as cancer and we fix it. Doesn't mean the first treatment works. Doesn't even mean the third treatment works. How do you think I got to like 85 plus treatments? And that has nothing to do with the hundreds of possible labs we may do. Now, not all at one time. We don't want to bury you, but I can't even tell you how many labs we order at large national labs that have defects, but in many areas they're quite helpful and they can show things that might be covered by your insurance. But, as they're increasing their 2,000% profits in a very short time, the idea your insurance is in it for you is really funny. It's really hysterical. So it's really about what you pay them is what you get. And if you get anything they consider remotely research, even if it's like a basic lab like Quest or LabCorp, oh, that's a research lab. Well, it's legal. It's clear, federally allowed. It's not, getting seaweed and like alligator dung and mixing it together with chicken broth and calling it a treatment. These are not absurd tests. So basically with insurance, you get what you pay for. So back to my point, if you're using a treatment that helps you 30%, don't stop it. Add some other treatment. And it's not like there's a shortage. And don't stop to you and those that love you and are around you or that you're working for or with or above. Don't notice anything that's depressing. All right, so be greedy for full removal of depression totally. I call that cure. I don't need to do a brain transplant to have it so you're like me. You never have depression again after decades. Thank you for your time. Oh, did I mention we wrote a book called Destroy Depression? Take Back Your Joy? No, I really don't remember the title. I'm in the middle of 4 more books. Have a great day. Thank you. Bye-bye.